Introducing the steps of the NovaSure Advanced procedure. Before utilizing the NovaSure RF controller, ensure that proper facility protocols regarding the use of RF generators have been met. Place the NovaSure RF controller on a small table to one side of the patient and within the visual field of the physician. Attach the AC power cord to the NovaSure RF controller and plug into an AC outlet. Screw the CO2 canister into the regulator on the back panel of the controller until tight. Toggle the power switch on the back panel of the controller to the on position. Connect the foot switch to the appropriate port on the front panel of the NovaSure RF controller. Animations are displayed on the graphical user interface and are consistent with the printed instructions for use. The on-screen animations are intended to guide physician and staff, as well as provide information regarding troubleshooting and common error conditions. Pressing the question mark icons allow users to bring up help screens, which can assist in troubleshooting of alarms and understanding error messages. Help screens can easily be closed by touching the area around the X. Open the sterile NovaSure Advanced device package. Place the disposable device and the connecting cord into the sterile field, while being careful to keep the non-sterile suction line desiccant filter pouch out of the sterile field. Open the non-sterile suction line desiccant pouch. If the suction line desiccant filter is pink, replace the filter prior to initiating the ablation procedure. Remove the protective red caps and connect the desiccant filter barbs into the suction tubing of the disposable device. Ensure both ends of the desiccant filter are fully inserted. Before inserting the NovaSure device into the patient, connect the disposable device cord to the appropriate port on the front panel of the controller. As soon as you plug in the device, you will hear an audible beep. This beep indicates that CO2 is flowing and that the disposable device and tubing is being purged. The purge operation takes approximately 10 seconds and must be performed before the device is inserted into the patient. Patients with a cavity length of less than 4 centimeters are contraindicated and should not be treated with the NovaSure device. In order to provide a customized ablation, the uterine cavity length and width must be obtained. The cavity length can be obtained using the SureSound Plus. First, dilate the cervical canal up to 6 millimeters. Then insert the SureSound Plus transcervically, past the internal os until the distal end of the device is in the uterine cavity. Once inside the cavity, squeeze the finger and thumb rings together to deploy and lock the malacot. Pull the device back toward the internal os until the malacot meets resistance at the internal os. Slide the measurement tab distally until the inner probe reaches the fundus. Determine the uterine cavity length using the indicating markers in the window of the measurement tab. Slide the measurement tab proximally to fully retract the inner probe. Separate the thumb ring from the finger rings to unlock the malacot. Before setting the cavity length, check the NovaSure device outside of the patient by deploying the array, opening and closing the device. Ensure that the array position warning on the bottom right of the controller screen disappears when the device is deployed and reappears when the device is closed. Make sure the width measurement dial indicates a value greater than or equal to 4 centimeters when the device is deployed. Once the cavity length has been determined, you must adjust and lock the NovaSure device to the appropriate length. This is done with the device closed. Once completed, press the Length-Width button on the RF controller and set the length value by depressing the plus and minus symbols. For the purposes of this demonstration, a cavity length of 5.5 centimeters will be used. Dilate the cervix up to 6 millimeters using a Hagar dilator. Using the blue handle, insert the device in line with the axis of the uterus until the distal end of the device touches the fundus. Withdraw the disposable device approximately 0.5 centimeters from the fundus. Slowly squeeze the handles together up to the point of increased resistance, but do not lock. Continue to slowly squeeze the device handles together while gently moving the device to and from the fundus and rotating the device 45 degrees clockwise and counterclockwise until the handles are locked. Once the device is locked, move the device using anterior, posterior, and lateral movements. To complete placement, slightly pull back on the device away from the fundus until the width dial reading reduces 0.2 to 0.5 centimeters. Advance the device slowly and gently to the fundus. The width should read greater than or equal to the previous measurement. Slide the cervical collar against the external cervical os using gentle pressure on the thumb tab. Keep the collar in this position for the rest of the procedure. Input the value shown on the width dial indicator into the NovaSure RF controller width setting by depressing the plus and minus symbols. The width of the cavity should be at least 2.5 centimeters. Patients with a cavity width of less than 2.5 centimeters are contraindicated and should not be treated with the NovaSure device. The NovaSure RF controller can be operated in two different modes, automatic mode and manual mode. For this procedure, the controller has been set to manual mode. In the default manual mode, you will be required to press the Enable button on the controller after the successful completion of the cavity integrity test. Begin the Cavity Integrity Assessment Test, or CIA test, by stepping on the foot pedal once and then releasing the pedal. To pass the Cavity Integrity Assessment Test, the system must be able to hold a pressure of 50 millimeters of mercury for 4 seconds. The test is sensitive enough to detect a perforation as small as an 18-gauge needle. Once the CIA test is complete and has been passed, press the Enable button. The ablation will not start until the physician depresses and releases the foot pedal again. In the automatic mode, the ablation cycle will start automatically upon successful completion of the cavity integrity assessment. During the ablation, the patented moisture transport system helps maintain contact between the array and endometrium and removes any excess fluid byproducts from the uterus. The radiofrequency energy desiccates the endometrium, and the procedure self-terminates once tissue impedance reaches 50 ohms of impedance or when the treatment timer reaches 2 minutes. The controller has an ablation timer which monitors procedure duration. The procedure is complete after 120 seconds or when the endometrium reaches an impedance of 50 ohms, whichever is achieved first. The Procedure Complete screen displays the following information at the end of each NovaSure procedure: cavity length, cavity width, power level, and RF ablation time. Once the procedure is complete, slide back the cervical collar. Unlock the handle by depressing the button on the side of the device handle. While holding the front blue handle stationary, pull back on the rear handle to retract the electrode array into the sheath using the bow and arrow technique. The closed array indicator, located at the hinge of the front and rear handles, will read Array Closed to indicate the array has been retracted and you can remove the device. Turn off the NovaSure RF controller. Unplug the NovaSure Advanced Disposable device. Perform post-operative patient care according to standard procedures. The used disposable device must be treated as biohazardous waste and disposed of according to standard practices of the hospital, office, or clinic where the treatment is performed.